So let's get started. Let's just have everyone maybe go down the line and introduce themselves to the audience. If we want to start with Val.
Okay, so I'm Val Serino, the Special Projects Coordinator.
S.J. Langer, I teach 2 courses.
Liz Deli-Carpini, Internship Coordinator.
Victoria Christoph, second-year student.
Sabrina Rodriguez, first-year student.
Jason Montalvo, alumni of 2017.
Debbie Farber, Chair and Teacher.
Robert Grant. I also teach 2 courses here at the School of Visual Arts Department.
Great. So I think I'm going to get started by talking, or having Liz, who's our internship coordinator, talk a little bit about the internship component of our program, because it's a really important process for our students to go through. So Liz, if you could talk about the internship process, kind of how that fits into the rest of the program as a whole, and kind of what role you play throughout that process.
If you're a full-time student, you will be engaged in an internship the entire time you're studying, so that practice is integrated with theory. And I work very closely with all of the students to individualize their internship experience. So once a student pays their enrollment fee, anytime that happens, I reach out to the student and we start that process. And so I work with the students' interests, their experience, and fine-tune some contacts for them. It's very much a part of your professional training is developing a resume, cover letter, interviewing, professionalism, all the way through to the direct service. And so the internships occur, one for your entire first year, one for your entire second year. We highly encourage students to have 2 really diverse internships, which means a diverse population, diverse level of development, and also a diverse setting. Maybe one in a hospital setting, a more clinically based setting, and one maybe in a more community-based setting, so that when you graduate, you have a really full resume where you can really apply to pretty much any type of art therapy job and feel like you have some relevant experience. As well, our internship program, you're going to be working with a team of people when you're at your internship, so which includes me as the internship coordinator, a faculty supervisor, of which Robert and Debbie and myself are all faculty supervisors, and also your on-site supervisors. So you have really a team to collaborate with, and we all work together with you to support your training. We encourage students, while you have all this support, to work through any issues that come up at your internship site, so that you really learn the specifics of what it's like to work in the contemporary art therapy environment. And so that's dealing with not only the clinical art therapy work, but it's also negotiating systems, working with staff, collaborating with people, getting the supervision that you need. And so that when you graduate, you're really able to work within the systems that are currently occurring in the field. I think that's
Great. And talking about that team of support that we have for our students during their internship, a core component of that is the supervision class, which is a 3-credit course that you take each semester that you have an internship. So Robert, you're one of the first-year faculty supervisors for the students. Can you talk a little bit about that role that you play, and a bit about the supervision class and what kind of...
Well, supervision is vital to the work that takes place as students become art therapists in training. In that environment, essentially what happens is that you go over essentially the ethical foundation of which is important for a student to be mindful of in doing the work with whatever population that they're assigned to. And also, in this environment, it is a supportive environment of peers, of which each of them have the opportunity to share their experiences from their placements and to establish commonalities. Because while they may be at different placements, they are experiencing similar things and trying to figure out, what is it that I do? How do I go about doing it? How do I then take the information that I'm learning from the different theoretical classes and apply it to the actual practical work? And these are core things that we try to really work with in supervision. In addition to that, we'll also look at trying to help people process what might be coming up through that relationship between the client and the art therapist in training. Students may not have had that type of experience before where they've had the responsibility of actually being a provider in a caring capacity. So that is important. So how to teach people to look at how they do the work, how they invest themselves in the work without being too invested, and helping people to actually establish and work with the clients in working with goals, using the creative process to work towards the goals that are ultimately established. There's so much that I can talk about it, but I won't go steal time. So yes, I mean, it is the beginning of their road in becoming an art therapist, and we take that very seriously here in this environment. We have some people here who have been in that very same place, and I'm quite sure they can speak upon that as well. I can also say hint, hint to the people who were in my supervision groups. So yes. So.
Yeah, but that's a good segue. I was going to ask Sabrina actually next because you're a first-year student, so you're kind of new to this whole process. You've been here for a couple months now. You went through with Liz kind of the finding of the internship placement and started just recently your internship along with your coursework. Can you just kind of tell us a little bit about that process for you, your personal experience, and also your internship site and what that's been like so far?
Okay. My internship site, can I say where it is?
Yeah.
Okay. It's at Boys Hope, Girls Hope, which is in Brooklyn. And I'm actually working in a boys' dorm. And they dorm there Sunday night through Friday so they can attend a private school, and they receive like full support at the dorm. So tutoring, residential advisors, and a whole wellness approach to make sure that these boys have like the best opportunity that they can to get into a college that best suits them. And I felt so supported by Liz from like the beginning. I got an email, I mean pretty much right away. It felt if it were nearly automated. And I tested Liz a lot because I was going back and forth. I interviewed at 3 different sites, but I think I looked at quite a lot of them. And this was like the best fit because I really wanted a community-based internship. I was aiming to work with kids or geriatrics, and they're adolescents, which seemed really scary, adolescent teenage boys, but that's part of it. You have to pick an internship that challenges you in some way, all of it's a challenge, but not the site that you think you'd be most comfortable with. And I go there twice a week. Honestly, the program is a lot if you're doing it full time because you're in school 2 full days, internship 2 full days, and Friday, depends, you might be doing a special project, or I took my elective on Friday, like 2 full Fridays. So, but through Liz, you kind of coordinate what time blocks are going to make the most sense for you. So this semester it really didn't seem like going to an internship at 8 a.m. twice a week was going to make sense, and I get there at noon, leave at 8. So there is it makes sense, and Liz really works with you one-on-one in person and like calls and emails until you find the fit. You're not just going to be put somewhere so you have work.
Yeah, and Victoria, you're a second-year student, so you've been through this process as well, and Jason, as an alum, you've been through the full 2 years of an internship experience. Do either of you want to add any thoughts to that as well?
Well, so as Liz mentioned, like having 2 really diverse internship experiences, I think is pretty important. My first year internship, I worked in inpatient hospital setting, and this year I'm doing more community-based work with a not-for-profit that works with court-involved adolescents. So kind of like learning how to navigate those diverse settings, I think, is a critical component to developing as a clinician. Also, like, you do have a ton of support. I had Robert as my first year supervisor, and now I'm in supervision with Debbie. And just like really utilizing all the resources that this environment provides for you is really helpful. Yeah,
and similarly, I was with Robert Grant my first year. In the internship experience, I chose to work with adolescents my first year, but then also my second year I worked with youth at a younger age. So I chose to work at 2 community-based organizations that were based out in Brooklyn. They were phenomenal experiences. Again, Liz really helped with the flexibility of understanding my schedule, how to really ensure that I had an adequate time to really address my schoolwork, also my self-care, as well as my internship experience, which is itself a full-time role. But even though you're there for the short amount of time, you get 2 days a week, 3 days a week. As Robert said, in supervision, it was incredibly valuable to understand how to manage and process those cases that you're working with. Your caseload would vary depending on the site that you're at, and you'd work with that organization to discuss that. However, SBA also does really protect you while you're at that site as well. They really provide a lot of support. You're not just given this internship experience and kind of just left to your own devices. There's still constant communication between Liz and your supervisor at that site. In supervision groups, it's just learning how to present case files and casework, really discussing and learning from your cohorts within that group as to how to possibly gain another perspective, just share, learn how to really analyze and assess a case that you may be having challenges with or you just want more insight into. You also really develop a lot of tools, such as one example, we present response art within Robert's group, which allows us to attune more so to the client, as well as also discover some of our own personal challenges that we would be having in that specific case. And so it's just a really wonderful, dynamic, supportive system that you have. And while you're here, there's a lot of investment to make sure that you're as successful as you can possibly be.
And just another thing to keep in mind that I think when I was coming into the program, it feels like a really long time ago, but you might come in with your mind made up about the population or the environment you really want to work with. And for me, from the jump, I knew I wanted to do adult work, inpatient psych, and Liz was really attuned to that being a setting that I was comfortable with or familiar with. But then kind of really pushing yourself to be as open as possible, because the more open you are, the better and more diverse your development will be.
So in addition to the internships, obviously we have a really rigorous academic schedule here for our students. So I was going to ask Debbie, who's the chair of the program, to talk a little bit more about the curriculum, and also you teach a first year class. So when you come in as a first year student, you're going to be having Debbie's methods and materials class, so maybe talk a little bit about that as well, and what kind of material you would cover in that.
Okay, so in methods and materials, that class, we look at the characteristics of different materials. Yes, everybody's an artist, and you're used to your material that you like to work with, or a few materials but what about the use of non-traditional materials? What about taking into consideration culture and power and privilege? All of that, what's available to the people that you're going to be working with. At the same time, there are continuums, there are all kinds of methods and materials, theories, relational aspects of materials, and learning to be attuned to a different language, which is that of art, nonverbal communication. And the beauty is having the availability of all kinds of things. Like, for example, this Monday, and Sabrina's in my class, we're going to be doing something on junk sculpture. So that sounds like fun, right? But it's way deeper than just fun. What's junk to one person is not junk to another person. The idea of having things that are thrown away that you find and can repurpose relates in certain ways to some of the clients who feel like they have been thrown away, from society. They've been marginalized for various reasons. So this is something that's beyond just fun. There's something deep. You understand it while you're using the materials and thinking about those kinds of things. So there's theory, there's practice. We start with very dry structured materials like pencils and stuff, and then throughout the class, we're going down this expressive therapies continuum where the materials start very dry and structured and safe and end up getting looser and looser each week until we're doing paints and clay and plaster casting and all kinds of stuff like that. So it's an interesting thing that the class goes through. They think a lot about how to use those materials with their clients. When is it appropriate? When not? Why not? And that's been a really interesting revelation. The students like start getting this, like over the course of the months, like wow, this is something is happening. I'm beginning to connect that there are characteristics and things that are beyond just let me choose oil paint. So that's important. Also, at the same time, in the first year, you're developing your clinical voice. Who are you? What style do you feel most comfortable with? How do you push yourself to go beyond that? But if you're a person who uses humor a lot, you can use humor in treatment. There's been a lot written about that. So all of those things, like developing who you are as a clinician, based on what your strengths are as a person, plus the ability to learn to sitting with people, not giving advice, not fixing, but just sitting with them and understanding what they're going through. And then through the art process and the relationship, learning how to move them past that. I think that's true of all the classes basically in the first year, right? And then in the second year, we're really it's a professional training program, so we're really getting you ready to go out into the world seriously and be a clinician. So we have less and less protectiveness over you, less control, less, you're being left with clients in certain settings to figure out programming and that kind of thing, rather than just always having your supervisor sitting with you and planning while you watch. Now you're planning, you're participating, you're leading. And that's how the program goes, over 2 years. So you're becoming more and more in the leadership role with an understanding of who sits before you in terms of culture, privilege, identity, power, etc. And materials that way, theory that way. We cannot just always assume that the Western way is the best. So that's how you're trained to think beyond who you are and what you came in with. Use those strengths, but go beyond it.
Great. And SJ, you actually teach a couple classes. You teach an elective class for us, and you also teach one of the first year classes as well. Can you tell us a little bit about your classes?
Sure. The first year class is interviewing and counseling skills, and in that class I cover foundational clinical theory, clinical practice techniques, a variety of theoretical orientations, and we also I hire people to play standardized patients, so they're actors who play patients, and the students interview them for an intake as if it was a real intake, and then you write your final based on giving sort of an overview of that patient and then reflecting on your work, your few minutes that you interviewed that person, the mistakes you made, the things you would have done better, particularly because my class is in the first semester. I don't expect that anybody knows what they're doing, right? But that I expect that you know that you don't know what you're doing. So the mark of a good therapist is that you know how to assess yourself, right? And how well you're doing and what you're not doing, right? So that's that class, and then which everybody takes that class, and then the elective class is a clinical practice class with across the gender spectrum, so working with trans, non-binary, genderqueer, questioning folks, and that's a 1 credit elective that's new. So I'm going to be teaching it for the first time this semester, and so that class is going to go through like current research, best practices. We'll see how it goes. I'm excited about it, and I'm really grateful to be able to have the opportunity to teach it here. And then I also just as like an extra thing, in the second year students do a thesis, and so I'm sort of the extra thesis help with people writing their thesis, and there's a thesis class that you take. But I really enjoyed being able to help people bring their ideas. Develop their ideas and bring it to the process.
Speaking of the thesis, Victoria, you're kind of in that process currently. Can you kind of talk to us about what that process is like as a second year student?
So it's manageable so far. So our thesis advisors are two professors. One who you do have experience with from classes first year. The second, she's also an internship supervisor. They're both really fabulous. But so it's mapped out in a way that you're kind of like chipping away at it really intuitively. Like the thesis advisors are also really open to your question, like your thesis question developing over time. It helps if your thesis is like pretty pragmatic to your placement, but again, open to interpretation. So it's little by little, you start thinking about your question, really like what you're interested in, what speaks to you from your placement the year before, and what you think, you know, is going to stick out to you in your placement this year, and you kind of let the process guide you. The first semester is heavy on the research and the literature review, so you're kind of picking and teasing out texts that again speak to you, speak to your topic, and then from there it kind of, it's like this really natural spiral that you kind of figure out your question a little bit more, you fine-tune it, and then you start considering your methodology and how you want to execute it potentially at your placement. And then second semester to be determined, obviously, but that's when you start kind of mapping out the results, the discussion, and all those things. But you get a lot of support. A lot of it is like working individually with your thesis advisor, a lot of peer review. I've been feeling like our thesis workshop is almost like a secondary supervision because you do discuss so much the work that you're doing with your clients and how it pertains to the bigger questions you're thinking about. And they're supportive, you know, if you want this to ultimately feed something down the line in your career, if you want to do a program proposal, if you want to consider grant applications, if it's going to be more case study based, there's a good amount of flexibility and encouragement, which is helpful because you can think it's like this large task that you can't see the other side of, but when you're being like guided through it, it's comforting.
One thing that we do with thesis is that the same group of students travel together in the fall semester and the spring, so you're with a peer group that really supports and knows your research, and you have the same teacher. So I think that helps with the support.
Yeah, because they're kind of like witnessing your idea come to light. And it's also really great to see what your peers are excited about, because this can also kind of be like a passion project of like, what are you really excited about in this field? You know, because down the line you're going to be a working professional, you're going to be an alumni, and you know, it's going to be, you know, it's like planting the seeds for your work.
And Val, you teach in the program as well. You teach the community access class, which is our fourth semester, right before you graduate class. And in addition, you run the special projects program. Can you talk a little bit more about both of those?
Sure. So special projects, you had a brochure when you first walked in, and this lists just some of the projects, but they're a unique piece to our program. I think we're the only program globally that offers a special projects and has a special projects coordinator. So it's volunteer for the students. It's very separate from the internship. It's short-term work usually, and it's about 2 hours. And I send the students a list like every week, every 2 weeks, and tell them, okay, so we have a project at a shelter or a hospital or school. Recently, Sabrina just did one, right, yesterday?
Yeah, yesterday.
Yeah, and that was at the Carter Burton Senior Center. So the students run the project, but there's always an art therapist there with them. So I either accompany them or a board-certified art therapist accompanies them. So it's a really good opportunity besides your internship. So you get exposure to, okay, so I've been working with adolescents. Let me see what it's like to work with a geriatric population. We have a group of attorneys that are coming next Friday. Victoria's part of that project. So 16 attorneys are coming here because they want a stress relief art therapy workshop. So we brainstorm the first year students and the second year students what can we do? So it's engaging and yet fulfilling sort of the clinical rationale for why they want to come here. So it's a really unique piece to the program. We also now have long-term projects. We've done that now for the past couple of years. Liz is going to talk to you about one of them that's been ongoing. She did last year and she's doing this year. That's up on our 5th floor. And I've done some long-term ones with women vets for a couple of years. And now I have one that's fairly new. It's only a couple months old, but it's working with women that are graduates of, it's called the New School, but not the New School. It's the non-traditional education workers. So it trains them, I see you're nodding your head, yeah. It trains them to be plumbers and carpenters, subway workers. So they're up against, a lot of pressure because it's women going into these non-traditional jobs. And they talk about the stress of that, what that's like. So it's great for the students to be exposed to groups that you would have never thought you would have worked with. And like, wow, I didn't even realize how much I liked working with adolescents or whatever. And then the other class that I teach is called Community Access in your last semester. So that's advocating for the field. And the field is so broad and is used in so many different there's so many different applications for it. So we talk about how do you present your work to a physician? How do you present your work to a social worker? So how do we advocate in the community? So we do in-services and practice sessions, and of course work on, briefly, because Liz handles a lot of that, resumes and interview questions that I've saved for the last 14 years, more difficult ones, that how do we answer that? And then the students have to do an advocacy project at the end, going out and speaking to groups that may not be familiar with our field. Because our field is fantastic, but a lot of people don't totally understand it. So it's a great class.
And going off of that, that's a very practical class that helps our students obviously navigate the at times anxiety-provoking and stressful process of after you graduate, going off and getting a job, getting licensed, that whole process. So Jason, as someone who has been through that process, having graduated, looked for jobs, going through all of that with your licensure, can you talk a little bit about that and kind of how SVA helped you prepare for that transition?
Definitely. The Advocacy Project was something that was of incredible value, especially community access, which provided us with the tools on how to learn how to seek out grants or how to research grant writing and proposal. There was the trip to the foundation.
Oh yeah, thank you for mentioning that. Yeah, I forgot the grant part. Yeah.
Yes, so it was an experience where it's an open organization that allows you to research and gain access to financial records, teaches you how to write proposals and grants, and in conjunction with the Advocacy Project, as an example, I currently work with Urban Glass. It's a glass working studio in Brooklyn. That's where I was able to provide my in-service, my advocacy project, advocating for, which is also my thesis, glass working as a therapeutic tool. And so with them, I was able to discuss how their own facility and the art and practice itself of glassworking could also be very beneficial to in a therapeutic capacity. And so with that actual project and that initiative, it was definitely anxiety-provoking, but we have had continual conversations. Now I'm currently working with their low-income, women of low-income project called the B Project, wherein I come in and I provide a lecture and also a therapeutic group where we can discuss resiliency building, how to apply what they're gaining in the space into their entrepreneurial aspects, as the program is assisting them in having a self-sufficient working artist life. And so through that project, it was just wonderful. And also with my previous position at the Coalition for Hispanic Family Services, where I had interned for during my second year, it became incredibly valuable as we were working with an after-school program. We were working within an after-school program, but that was based within one of their 10 day school sites that we would operate within. So through that, that gave me an opportunity, and I was requested numerous times to provide art therapy information sessions to the day school staff, just so that they understood more so what art therapy is, how it can benefit and reflect. It helped build relationships with the day school staff so that my therapeutic approach and time with my students and clients could be more effective and more critical. And so with that, it was just very dynamic, and everything does flow. Initially, it is all very overwhelming and it can be very anxiety-provoking, but it's all incredibly valuable. And again, it's provided to you in such a structure through Val, through the entire team here at SVA, that you're gaining that from the second you come in, and learning how to develop your own therapeutic approach, your own therapeutic identity, and then taking that into the field. And so with that as well, other students have gone out to Google, I recall, and other organizations where they were able to pitch. And a lot of it is also cold calling, because you will definitely sometimes not find, it's very challenging at times to find the exact role that you would like. And so that class especially really encourages you and fosters your strength in being able to just walk into an organization, a facility, ask to speak with whoever is available at that time that may be able to facilitate that conversation, and that, and also to just learn how to, again, pitch art therapy to them. And there's been a lot of success with the students from SVA in being able to have organizations that normally wouldn't even have had art therapy to begin with to develop their own small private practice, or offering art therapy to their employees, staff, or the populations that they serve.
Great.
And also, throughout that process after you graduate, you would go about trying to get licensed through New York State, and obtaining that license to be able to practice as an art therapist and get a job through that. Robert teaches a workshop for our second-year students right before they graduate to kind of help navigate that process for our students. So Robert, can you talk a little bit more about that?
You remember that workshop, right?
Oh, I do.
I often tell everyone about licensing is that it's not as difficult as you may think it is. What I do essentially during that workshop, and it's about a 4-hour workshop, is I break down what the process is from the moment that someone obtains their degree all the way into the relicensing process. So step by step, walking them through what needs to happen in order for a person to first obtain what is called their limited permit, understanding those parameters, and the fact that within New York State, you cannot work unless you have a limited permit, and that allows you to work with underneath the license of a creative art therapist. So this gives the students, this workshop gives the students that piece of information, because as far as I'm aware of, I think we're the only one that does this.
Mm-hmm. Yeah, it's amazing.
Yeah. So things like that in terms of the that initial application process, talking about how to look at potential avenues to explore in terms of resources of potential employers. On the Office of Professions website, there is a place where someone can actually explore and say, wow, I didn't know that all these particular opportunities exist where people could be supervised by our therapists. So I expose the potential graduates to that, and we talk about how to go about setting up that structure. I walk them through licensing. I walk them through how to work towards obtaining their hours for their art therapy registration, ultimately obtaining their board certification in art therapy through the Art Therapy Credentials Board, and also talking about the renewal of their license once they get it. So it is a very, I would say, organized workshop by which each student walks out not only with charts of what cost, what from what areas specifically that they would have to focus on, and they also walk out with a booklet that is each student in SVA gets that's theirs, and it tells them how to do what from what. And far as I could tell, because I get emails intermittently from people, yes, it's been helpful, et cetera. So we've had a very good success rate, I would say, through this process and getting people licensed. So I would say the workshop is one of the many jewels to the crown of the art therapy department.
And I want to pose one last question to everyone on the panel, and maybe we can start with Val and kind of work our way down the line to conclude the panel session before we open it up to questions from you guys. So starting with Val and for everybody, what excites you most about the work that you are doing?
So many things, but just the creativity, that it's just not a cookie cutter job, that there's so much to it, it's such a wide arena to use, and probably everybody in here, loves art, loves psychology, right? And just the different combinations and the different ways you could use it. And I love, Debbie gives us a lot of autonomy. I love that I can go out and advocate for the field because I believe so strongly in it. So I'll keep it at that.
One of the things that excites me, especially with this, it being a first semester class, is really seeing students' minds open to how they have to work differently, how to think differently, how to be differently as a professional, and seeing them start to understand the concepts and understand how this concept actually relates to work, and then seeing it happen in a session and coming back and saying oh yeah, I saw that thing that you just talked about happen in the session. And I like being around people who want to learn. So I always like to keep learning. So it's exciting to be around students and to keep getting re-excited about the work. Working with students, keeps me fresh and excited about seeing patients and working in the field too. So it's great.
Yeah, for me, it's the freedom to be very creative with my practice, and then to bring students into that, whether it's through supervision, through the coursework I teach, and also the special project that I'll be talking about later. I really enjoy, the focus of my practice has been working with system involved, young people who are system involved, and it's really exciting for me to be able to have the freedom to really develop programming for this population, and then to bring students into it to collaborate with me. That's really exciting to me.
Well, one thing I really love about this program is how pragmatic it is. It's a lot of applied learning, and it's really rewarding. Honestly, just spending time with people, your clients, but just people in general. It's definitely in the moments where the work can feel like you're really in it and you're in the thick of it. It's simultaneously the most rejuvenating part of the entire process. This week I was sitting in supervision with Debbie and I was I forgot how it's the work itself that brings you back every time. So yeah, it's inspiring.
I'm really excited by the relationships I'm building with my fellow students or with faculty and my internship, and also that whenever you feel something's missing or something excites you and you mention it to anyone, a friend or a teacher, they always say, oh, I have an article on that, I'm going to send it to you later. And it'll be in your inbox by that night. Yeah. Or next class will say, so-and-so mentioned this and we're going to integrate it into the class. So you just feel really heard, and you're definitely getting what you want out of the program each time. And each week is building upon itself.
Similarly about just that creativity and wonder, I think what always excites me is just seeing how impactful that connection, or building that connection from art to the client and having them resonate more so through that process. Be it, especially with the youth that I've worked with, I think it's always just a really great and exciting moment where there's just absolute relief that they get in their time. I mean, it's a break from their time in school where it's incredibly structured. It's constantly evolving. It's constantly challenging me to look at art through their lens, and numerous other lenses, just because their perspectives are so diverse and changing constantly. And so there's never just this formulaic approach to it. It's always unique to that child or that client or group. And it's just always incredible to see how effective it certainly is in that moment, in that space, be it and also with your own artwork as well. Just learning how to even take your own artwork further and just develop yourself further as a professional and an individual.
To me, I started the program. I taught undergraduate art therapy here. We had a minor and we had a post-baccalaureate certificate program, and the president asked me to write this master's there. Oh my God. But anyway, I really thought about, I already had been a therapist for years, and I really thought about what what brings great meaning? What did I really love and what do I still love and what matters about therapy? And that's how I built the program, and I asked people, like people in the undergraduate faculty, and together we came up with ideas about what really excites us, and that's how I wrote that program. And then I had I have two children, and one of them was an artist, still is, and really interested in art therapy. And I thought, what would I want for her? And that was it. That was it. Just having a person that you love and care about, what do you want for them? A multidisciplinary approach, having different clinical voices come in. That was thrilling to focus on her and see how would I build this if I were building it just for her. Anyway, so that was one thing that was exciting. And then bringing the people in who are going to teach these classes. So we have a psychiatrist, Marcus Kraber. He's a child psychiatrist, and he teaches child psychiatric residents at Columbia. And he comes in and teaches the DSM-5, and he's a painter. Like, who better than him to teach that class? Every time I sit in on the class, I'm like, oh my God, teach me. He's fabulous. So there are people from all walks of life that come to teach here, and it's of great value to the students. And that's thrilling. And it's thrilling to teach a class in the first year, methods and materials, and then in the second year, teach supervision. And Victoria's in my supervision class, and I'm thinking, my God, these people are 25 or less, and they're working with incredibly challenging populations, and they're so into the work. I feel like I learn every day. So it's exciting. Yeah. And plus we have a great community. We've built a great community of clinicians, of students, of faculty. Last year we had 100% employment. So every student that graduated from the program got a job, and they got a job pretty quickly. So that's really exciting and a testament to the kind of work that is coming out of here, which is great.
So I guess I'm going to close it then. What excites me, it is this place. I say to Debbie often that if I had the opportunity to go here as a student, I would be banging down the doors to say, can I come in? Because this is a place that is so exciting, so vitalizing, filled with so much creativity, a diverse staff. It is a place that you will learn. It will be hard. As I've told former students, it has been, but this is a place that encourages you to learn. It fosters creativity. It inspires. It believes in the creative process. It is those things and many more that excite me, and I've been fortunate to be able to teach here, to be able to provide what I can, and to also learn from those who I teach. So.
Well, I want to make sure that we save time for Liz's presentation. So why don't we have her talk a little bit about her project, and we'll also save time after Liz's presentation for questions specific about her presentation, and then anything additional that you can come up with between now and then. So I'll turn it over to Liz. She's going to be speaking about a project that she's doing with a few of our students in our 5th floor space.
So as Emily explained, I'm here to talk about a mural project I developed and organized here at SVA as a special project. There have been, I would say, almost 100% of the students here have participated in this project in some way. I'm going to give just a really brief overview of the project, as well as describe how the variety of ways that students and as well all of you can participate in this project. So in broad terms, this project is a collaboration between young people involved in New York City's justice systems, institutional communities, and the general public. This project is a community-based art therapy, and so I'll explain more about what that means for those of you who are unfamiliar with the term. but it's basically expanding practice beyond the medical model of practice. And all of you are probably familiar with the medical model of practice. It's kind of the traditional psychotherapy where you go either individually or as a group, confidential sessions, closed doors sessions. You're working on really, if you're a client, you're working on like kind of problems within yourself that you're struggling with. And community-based art therapy is just expanding the work when I find in my practice, in the confidential practice, you kind of bump up against a wall where the problems that you're dealing with, the presenting problems that you're dealing with are becoming more social and society-based than they are anything that the individual can deal with on their own. And so just a brief history of the project. It began in 2017 as a collaboration between the independent nonprofit Artistic Noise. This is the storefront located in Harlem. It's Victoria's internship this year. And the MPS Art Therapy Department here at SVA. This project developed, I have a very long-standing relationship with one of the co-founders of Artistic Noise. We met in 2003 when we both worked together at a alternative high school here in New York City for young people who are involved in the justice system. Lauren is her name, Lauren Adelman. She is an artist and an art educator, and we developed together at the high school an after-school program that became the seeds of what is now Artistic Noise's art, entrepreneurship, and curatorial program, which is called A&E. And so this program is an intensive program limited to 10 participants. The goals are to create, is to work with the young artists with collaborative business and creative skills to develop those skills. And a key component of this program is that all the young people are employees and they're paid for their work. And that's a really important component of the program. So our collaboration builds and expands on those goals. Students here at SVA, they choose a variety of ways to participate. They may be involved in the entire program, which lasts about the length of the academic year. They may drop in for some sessions. They may participate in public events. I'll give more detailed descriptions as I go on. Just to note, in general, if you see any photos of the A&E artists, their faces aren't shown. That's to follow Artistic Noise policy, and they're all identified by their first name only. So students are involved in the initial planning, which includes identifying the presenting problem. And that's something that you would do with any case in any setting. And we train students how to do that here. In this case, the presenting problem is society-based. And so here you can see some statistics from the US Office of Juvenile Justice. And in the United States, as you can see, since the mid-90s, juvenile arrests have been on a serious decline. But what has also been happening is the disparities between young people of color and white young people have actually been growing. So in the mid-90s, and particularly for white, between black and white youth. So in, for example, in the mid-90s, the disparity was 2.1, and currently the most recent statistics, which were in 2017, if you are a young black person, you're 2.6 times more likely to be arrested than if you're a white youth. And so that seems to be a huge problem. In New York City in particular, according to the New York City Office of Juvenile Justice, 95% of juvenile detentions, that means you're arrested and detained, are young people of color. And the Correctional Association of New York cites that all of these detentions almost overwhelmingly occur in neighborhoods with the highest levels of poor housing, underperforming schools, and poverty. So that's really not a problem within each young person. And so here, Joe shares his lived experience of these socially oppressive statistics. And so when I was working with Joe and some of the students were working with Joe, he was always clear to point out, see the shovel? He says it says property of society. I don't know if you can see it up there. And he explains society is burying me. So we also always identify a reason for referral specifically to art therapy. So there's a presenting problem, and then why is this group or this community being referred to art therapy? And so a basic task of adolescence is social bonding and trust that's necessary to become a contributing member of society. So obviously if you're arrested, there's something going on there that you're not becoming a contributing member of society. And so what I heard from the young people that I've been working with over the years, and this specific group of young people, is that there's a huge lack of opportunities within our society for them to develop the trust that's necessary to do this. Here you can see, so this is a quote from two of the young people that were involved in the first year of the project, Lamont and Bishop. In the photo you can see Bishop working with one of our current, actually alumni, but she was a student at the time, Kate. And I think their quote speaks really eloquently to that lack of trust and how they're really used to taking care of things on their own. In addition to trust, the young artists also identified how representational systems in our culture constrain their agency. And here Angel is collaborating with two public participants by sharing the intentions of the mural he created here. And we view collaboration in really broad terms. Angel wanted to collaborate with the public through collaboration, through dialogue and conversation. And so we respected that. And so obviously the goals are society-based, which requires non-confidential practice. You can't address those goals within a closed group, which isn't to say that we don't work intimately with young people, but there's a lack of confidentiality and a need to include the community and society in practice. So our goals for the project were also to build upon the AME program's goals. So we, as a community and society, offer the young artists real-life opportunities for social support, leadership, and employment, build trust. And so that's trust, relational trust, not only between people, but with place and institutions, and also to critique the representational systems that constrain their agency. And so here you can see Joe, he's working with two students are supporting Joe to also engage with a public participant to create his mural. And he identified that he wanted people to help him create the environment, to paint in the environment. Okay, so a brief overview of the process. This is not easy to achieve by any means. So we begin, I work with a group of students to build a support team. So at first we go to Artistic Noise in Harlem, to their storefront, and we meet with the young artists there in their space, which is this is really important. We built an initial support team of SVA students, myself, Artistic Noise staff, which includes an art therapist who's working there, and also teaching artists. And so the teaching artist component is really great because students also learn how to collaborate with artists and really develop the art part of their practice within clinical practice. So in this phase, we brainstorm, organize, and plan for the mural installation and work on handing over leadership to the young people. And I work with the students in the same way. And so I'm also working on handing over leadership to the students in that way. So we're all kind of stepping back and reversing or altering the norms of the hierarchy within therapeutic relationships. And so this is the first session last year. And as you can see, it's really hard to tell who's a young person, a young artist, who's a student, who's a staff, who's the executive director, and that's really the point. That's really the point of the process. process. And so the next phase is that we transition to SVA up to the 5th floor. This is one of the first sessions in the first year, and we decided to actually bring the artistic noise storefront here because the young people were feeling really uncomfortable in this space. And so we begin just projectors, images that are meaningful to the young people, and we structure it through large projected images, and the students support the young people in this phase as well. There's an intimacy, a real intimacy to the work during this phase. Here I am working with Lamont and Juwan on their mural, and getting to this point is really not easy. These young men told me over and over and over, I work alone, I work alone, I work alone. And I think Victoria can speak to that, and any student who participated in this project can speak to what that's like. And they have a really good reason for working alone. They have lots of reasons not to trust people and not to trust adults and not to trust society. So we respect that and work through that. Students do that as well. So Angel was one young man who was very clear about working alone, and these two, Mary and William here, really were persistent in offering support and respecting his boundaries, and he got to the point where he was really excited to work with them, and by the end of the project he was telling me, you know, I love collaborating with people. And so the students, you can either, like some of the students just drop in for one session, for part of one session, some stay involved the entire time, and so it's a really open process for student involvement. And so one thing that I think a core component of this practice is that developing these relationships are not easy. We have to not only acknowledge but address the social inequalities that exist between it's myself, the students, and the young artists, and each student develops and manages these relationships based on the particulars of their own social location. So in some cases, students are feeling really validated by what the young people are putting up on the wall, and in other cases, feel guilt and shame, really uncomfortable feelings. And so we really struggle through those emotions and stay present with whatever comes up in the moment. And it's because of that struggle to engage that we get to a point where we're able to expand the support team through public events. So this is the first public event we had in the second year, and each artist has different collaborative goals, and the students really ensure these goals are respected during the public events. So they work as like mediators and also as clients and participants as well. So here Samantha's on the far right. This is her second year of participating, and she identified her goal very early on, which is realized here at the public event, is that she wanted to lead an entire team of participants, including members of the Artistic Noise Board, which there are some members here, there are students here, there's general public here, there's staff, and so this was really empowering for Samantha to experience, and she explained how meaningful having this opportunity for leadership was. And she was like, I didn't really think people would listen to me, and when I realized they would, I was able to move from a very small mural that I did in the first year, and in the second year expand to doing a whole wall. And so we also offer, in addition, we also, in addition to public events, we also offer an expansion of other opportunities. So in the top slide, this is an opportunity that I think in the first year that we did the project, we also have other groups coming in here. And so this is a leadership opportunity where I think 5 or 6 of the A&E artists accepted an opportunity to lead a closed group for another group of young people with diverse abilities in an independent living program around their murals. And so the students and I prep do role plays, worksheets to prepare the AME artists for this leadership role, then we basically step back and offer a supportive role and let them lead the group. And other opportunities we offer, which I think is a really, really significant piece, is opportunities to be guest lecturers here at SBA. And so, and the bottom slide here is my adolescent art development class. And so instead of me coming up and presenting a case, which is kind of the norm of a medical model, the young people are given the opportunity to present their own case to the class. And so in that way, the classroom becomes part of practice as well. So all the students in that class are practicing as well as learning the course content. And here, Ivan and Kevin are presenting their work to, I think it's your class, Victoria, last year. And they're also, and the key component is they're paid the guest lecturer rate, just like any other professional coming in, they receive a check from SVA. And so in quantitative terms, these are the therapeutic gains of the project to date. Again, a key component is like 6 young people were paid here as guest lecturers. Some of them spoke last summer in Debbie's and Emily in the international program, so they reached an international audience. And I think SVA admissions contact is an important piece too. 3 of the young people have had contact with SVA admissions process. One actually advanced to a portfolio review. One young man I just found out recently received a mural commission at Google to actually be paid to create a new mural there, which is really exciting. And so I know quantitative results can be pretty dry. So these are some quotes from participants to bring these cold statistics to life. So the blue ones are from the young people, the green ones are from Artistic Noise and SVA participants, and the purple ones are from the public. I guess since you are all here interested in being students, we can stress some of the student responses. And so for some of the students, they would say, I saw myself represented in that space. Others felt, I'm used to painting my own vision, and here by painting someone else's vision, I gained a new perspective. I learned the importance of being patient and the impact the social environment has on practice. And so just to close, this presentation is also part of practice. The young people's art and quotes are being referenced throughout, and now you've all become participants. I'd like to leave you all with Ivan's guidance, and by following his lead, you'll be expanding the practice outside of this room. So he says his work is here with the rose, painting a rose coming out of concrete, and his statement is, you have to be delicate with the rose. If you hurt it, you hurt yourself. But if you handle it with care, you will both benefit. When you collaborate with me, I hope you will understand that people are meant to be handled with love and care. And so, just to end, if you would like to participate, get on our general distribution list. We're going to be having, we just started the 3rd iteration of this process last week. We're moving upstairs on Monday, and we'll be having public events later in the semester. So you're welcome all to participate in that. If you are an actual applicant, you can contact me if you would like to participate in a Monday session, and I can arrange for that. Thank you.